With my presentation, I would like to start with the information that probably most of you already know, that we in Africa, we are in a continent that has 20% of the global population, but houses 25% of global disease burden. And yet, we contribute as little as 3% of global research. So that mismatch is something that if you are in this room or you're online and you would like to be part of reversing it, this is a presentation for you this morning. And so the organization that I'm going to talk to you about today is something that was formed in the backdrop of two very important informations that we need to talk about in Africa. And the first one is the Abuja Declaration. I think that has been mentioned a little bit already, but this is where our African Union heads of states committed that they will allocate 15% of national budgets to healthcare. And a year after that, in 2002, we saw the formation of the Global Fund, which is very instrumental in providing solutions in terms of drugs, vaccines, diagnostics, mainly around TB, HIV, and malaria. But even at that time, there was still a question of what will happen if these drugs and vaccines stop to work, or we need new ones. So the formation of EDCTP was really timely in 2003 and was launched in 2004. So what is EDCTP? It is a partnership between 15 European countries and 30 African countries. This slide was made last week before Namibia joined the partnership a day after. And it has been on the continent for the last 20 years, as I've said. And really, it is there to support the global health plan of the EU and in partnership with Africa, but also meets the Sustainable Development Goals. And it is a vehicle for the EU Global Health Strategy, as well as the EU Innovation Agenda that we are talking today. And what does the organization do? It is really about funding, supporting clinical research in sub-Saharan Africa, and also benefiting global health globally. It was started, as I said, in 2004, going through those three phases. Phase 1 in blue, and in yellow, phase 2. And I'm here today talking about the third program, where I'm going to hinge a little bit on what opportunities are there. So the main focus is infectious diseases, mainly on clinical trials. We fund all phases of clinical trials from phase 1 to phase 4, but with special emphasis on late-stage trials. And capacity building and building networks is part of the business. And that picture there just shows you how we conduct business, that clinical trial is at the center of all the business that we support, but capacity building and networking, as I've mentioned, is part of it. So it is really a global program, because in funding the EU-Africa partnerships in terms of consortia, we also have partnerships outside Africa that are part and parcel of this agenda. As you can see from that map, participants from Australia, United States, Canada are part and parcel of the program. But more importantly, internally, we work with the big partners, Africa Union, Africa CDC, WHO, AUDA, NEPAD, and many other partners that are working in Africa. Just to give you a flavor of how much this entails. So, for example, in the last 10 years, with just 1 billion euros, we were able to support 692 programs or projects. And this covers a whole range of projects: clinical trials, capacity development, networking, and building capacities in terms of fellowships, etc., etc. And EDCTP3, in just 2 years, it's picked up from there with just close to 300 million euros. We have supported 74 projects already, again, in major categories of coordination and support actions, but also capacity development and clinical trials. So that work, for example, comes into what we call calls for applications, which I appeal to all of you to look out for in the next fall of the year in January, because that's when these calls come out from. So those projects that I talked about just over 70, came out of this type of calls for proposals. And as you can see here, there was a call for developing HIV therapeutics for 22 million, malaria vaccines for 30 million, and therapeutics for neglected infectious diseases for 22 million, etc., etc. So sometimes, as you know, things out of the ordinary start to happen. That was the work plan for 2024. We didn't even know that we would have mpox. And then an additional 12 million had to be put to the program to support the first 5 projects that had ranked very highly, and these projects are now operational in those African countries you see there on the map. So what will come in 2025 is more or less what I have summarized here. I haven't put the budgets across them because just today the Joint Undertaking Board is meeting to finalize approval of this, and if it's approved, you'll see it on the EDCTP website. In January, we expect to launch a call on TB vaccines, malaria therapeutics, neglected tropical diseases vaccines, fellowships, which are trainings, and then preparedness networks against epidemics for the future, including what we already have supported under networks in sub-Saharan Africa. And there is also a special call on climate change and health, focusing on diarrheal diseases. And the last one will be on disruptive innovations. And of course, room has been left to cover epidemics in case they occur. In terms of participation, the countries in blue are already in the partnership of Horizon Europe and able to receive EDCTP funding. And you can have countries also from outside Africa, but they have to bring their own resources. So those that are in gray on this map are countries that if you partner with them, they have to make their own resources available to participate in the partnership. And lastly, I would like to also point to you the opportunity for collaboration, which is in the form of a forum which EDCTP holds every 2 years. And the next one, as it shows there, will be in Kigali next year in June. And we expect many of you to be there. And if you go on the website that is shown there, there's more information about how you can register or plan to have a symposium, etc., etc. And more information, you can find me in the corridors in the next 2 days. Thanks for your attention.
Last question over there.
My question is directed to Dr. Nyirenda. We made a very good presentation on clinical trials. 692 financed, 1 billion, the tune of $1 billion US. What I would have liked to hear a little bit more are the outputs, because the purpose of clinical trials is to get approval of certain, drugs for commercialization. So what have been some of the outputs with those colossal sums of money that have been invested? Thank you.
Thank you very much. If I may respond, it was indeed very difficult for me to squeeze in your investments outputs on there, but just to mention a few. When I was being trained in HIV, for example, we didn't have antiretrovirals for children. And our specialists taught us to break the tablets of adults and give it to the mother to administer based on the weight of the child, which was really non-scientific. But through EDCTP, we have now ARVs that are child-friendly. They test better. Some of them are in syrup. And these studies were clinical trials funded in Zambia and Uganda. And now the drugs are in the PEPFAR program, for example. That's one of the best examples I like to use. But we have the Gene Expert for diagnosing TB, which has reduced the duration. People have to stay before they know the results, whether they have TB or not, from 3 days, sometimes to weeks, depending on where the patient is in their socio-economic status, that they can come to the clinic to give another sample of sputum. Now, you can go in the clinic, you give a first sample, and then within 1 hour, you know whether you have TB or not. And that study was funded by EDCTP to develop that instrument at the University of Cape Town. Then we have other instruments in malaria as well. There are certain tablets that are now produced through these collaborative trials in West Africa that are simple for uncomplicated malaria. And some of you know the RTSS vaccine now, which is now into EPI programs. Although that program was started by other funders like PATH and others, and GSK, but EDCTP sites were used to develop the intervention with large phase 3 trials. So sites like Mozambique and others that participated. And we're proud that now it's a global policy. We have treatments against opportunistic infection. One of it is cryptococcal meningitis, which has now liposomal amphotericin B. It's also out of EDCTP. So the list is long, and we are proud of it. But as the chair helped me, we need to do more. The problems are many. And this is just talking about infectious diseases. We haven't gone even into non-communicable diseases. We heard about prostate cancer today. What can we do about it? So the challenges are huge. But yeah, thanks very much. We need to be proud of what has been achieved already.